The number of patients to die in UK hospitals after contracting COVID-19 has risen by 23. Health authorities this afternoon confirmed that 20 people had died in England and 3 in Wales. There were no fatalities in Scotland, while Northern Ireland has yet to release its daily figure. Those who died in England were aged between 43 and 96, the NHS said in a statement. Later today, the Department of Health will release the number of confirmed deaths in all settings. Earlier this week, the government's chief scientific advisor, Sir Patrick Vallance, warned that the daily death toll could be in the 200s by November if measures aren't taken to stop the virus spreading. Yesterday, 38 fatalities were confirmed in all settings, while the number of new cases increased by 6,874, the highest of the pandemic so far. The coronavirus transmission rate across the UK could now be as high as 1.5, according to government advisers. The government's Scientific Advisory Group for Emergencies, SAGE, has estimated that the R number is between 1, 2 and 1.5. That is a significant leap from last week, when it was thought to be between 1 and 1.4. There is now a widespread growth of the epidemic across the country, the group said. The R number shows the average number of people each person with coronavirus goes on to infect. If it is below 1, then the coronavirus outbreak is under control and will eventually subside. If it is above 1, then the virus is likely to spread at an exponential rate. Data from a range of government sources shows coronavirus infections are surging dramatically at the moment. Yesterday, Mirror Online reported that a woman who spent 45 days battling coronavirus is warning others to stick to the rules as the consequences are devastating. Julia Brockway is still suffering the physical and mental effects 4 months after returning home from Morriston Hospital in Swansea. During her time in an induced coma in the hospital's intensive care unit, 50-year-old Julia lost almost 4 stone in weight and needed a massive blood transfusion because of the virus. She said, "I was unlucky. COVID-19 was not pleasant to me. It may not be pleasant to you. Please follow the guidelines. Stay safe. It may not be you, but it may be a loved one that has what I've had and has to go through what I've gone through. COVID is a dangerous and vicious disease. You don't know what it can do to you. I've seen the stress that the doctors and nurses are under and the worry on their faces whenever another patient comes in." Close quote.